Hi there! This is once again Jacob John and Rinku Janau from Tiju's Academy. Today also we have come again with another role play. Here, Rinku is going to play the part of the nurse and I'll be the patient. A patient who's totally concerned and worried about her skin condition and visits a city hospital, particularly to speak to a nurse what can be done for her condition. So let's watch it.
Good morning. I'm Susan, one of the registered nurses of here.
All
How can I
right.
help you?
I guess this is the dermatology department, isn't it?
Yes, you're in the right place.
All right, Susan. My name is Alicia, and I'm having a little bit of an issue with my skin. I think you can help me out, and you're the right person to help me out.
Yes, I am. I can sense it. Like your hands are looks like so red.
Exactly. I just
What
have to wear
happened
full sleeves
exactly?
over here. I'm not supposed to do it, but still. Do you want to see it exactly?
No,
Because
I
I'm
can sense it from the
having-
wrist.
Yes,
you
yes.
can-
This area
Yeah.
completely is like getting borched by the sun, and moreover, I was having a little bit of an itchy feeling, a brushy feeling and all. I was having small granule sort of bumps on my hand. I'm not sure about it.
Okay.
So, what should I do? I don't know. It just happened all of a sudden. Perhaps I started noticing this 2 weeks ago.
Oh, 2 weeks ago, you're
Yes,
saying?
exactly. 2 weeks
Okay.
ago.
Could you please tell me exactly when it is happening? Is it like some patients are suffering because of like climatic change, or some others are suffering from the soap? Like allergic to some soap after bathing out, some sort of issues. Could you please tell me exactly when it's
Well,
happening?
exactly. I'm not aware what exactly happened to me, but I don't use soap that much. I do use body wash. And apart from that, sun was not at all an issue for me because I love taking sun baths during the weekends. I'm working in a software company, so my job is very hectic and I'm addicted to caffeine. Without the coffee, I'm totally like lost.
Okay.
It's something else. But if I do remember correctly, it seems like I had a chocolate 2 days ago,
Okay.
and when I read through the ingredients, I found out that it was having hazelnut. I'm not sure
Hazelnut,
about
oh,
whether I'm not sure about whether that's the cause. But if I remember again correctly, it seems like I have taken hazelnuts earlier. This is not a big deal. But please, can you do something? What exactly are you doing for patients like me?
Yes. We can rectify it like after a blood checkup.
Oh, I
So
see.
we can rule out what you are allergic to what. So we can really understand what is the real cause.
All right.
So as I mentioned earlier, it's like because of climatic change, dusty. Also, you mentioned like sometimes you're allergic to hazelnut, right? So
I'm not sure about it. Let me just point it out to you. I'm not
Yes.
sure because
Not
2 days
sure,
ago,
yeah.
as I've told you, I've eaten that, and apart from
Mhm.
that, I've earlier also taken hazelnut. But at the time, I didn't find any particular issues with my skin.
Okay, I
Yes.
can understand your feelings. So nothing to worry much. Like we can after analysis we can rule out what is the
All
real
right,
reason.
and I hope that the blood test is not that much complicated, nor
Not
it's giving
at
me a
all.
lot of pain.
Not at all.
All
It's
right.
not painful.
Is there anything else that you can do just to make it subside for the time being, on a temporary basis or something? You just help me out with it.
Yes, it's, as a precaution, I can advise you for your bath. Like you can use oatmeal bath.
All right,
Yeah.
that's really great. I've heard about it in spas only. So you want me to do that? All right, fine.
Yes, it will be give a soothing feeling and all. Like if you're using soap, try not to use like hard soaps and like try to use like fragrance free soaps and all. Also the detergents while you're washing and all, you have to be careful with that. And also maybe I can send you to this pandemic. You are using any kind of maybe hand sanitizer, right?
Yes, exactly. I'm
So-
using, but I'm using the floral one. It means that it's a little bit delicate on my skin. First, when I noticed that I came to understand my skin is really sensitive. So it's when it turned out to be an issue, I just switched on to a sanitizer that is totally floral, and it's also safe. It's like a baby skin, sort of kind.
Oh, then-
Yes.
Then it will be fantastic. You
Right,
already
yes.
know about that. So
Mhm.
do you have any other issues regarding
Well, I
the
don't
diet?
have a particular issue other than this, but as I've told you earlier, I used to love sunbaths during my weekends. I used to go to the beaches and used to enjoy the sun. I used to absorb it. But lately I came to understand that I cannot tolerate the sun anymore. If you can see the size of my face is over here, a little bit on my neck, it's totally bulged by the sun. And I'm in fact using a sun protection factor cream, but it's
You are
not
using
giving.
it?
Yes, I am, but it's not at all giving me a result that I'm actually desiring. So there must be something wrong with it. Is it?
It can be maybe because of the sun exposure and also maybe
Right.
because of the mud over there.
Okay.
So you are exposed to both. So that can be also maybe a reason.
All right.
So we cannot completely say that is a reason, but
Alright.
after testing only we can say what is
All
the
right.
root
So what you
cause.
want to say to me is like blood test is the only remedy for this. Like, after blood test, only you come to understand what I'm going
Yes,
through,
we
isn't
can
it?
completely understand what is the
Okay, so
diagnosis.
once
Yeah.
again, I would like to ask you, could you
Yes.
please prescribe something, or perhaps speak to the doctor, or make a way so that I can speak to the doctor and find out what again give me, like something of a topic application just to subside, giving me a soothing feeling or something? Could you please do that?
Yes, like some hydrocortisone creams are there, like
Alright.
anti-itching creams are there. So it will be better for you to
Thank
heal up.
you. Thank you so much, nurse, for showing the patient to see my particular area was affected. And apart from that, explain to me what can be done to make my condition and situation fruitful. Thank you so much. I'm so grateful.
Hope you understand everything
Yes,
well.
definitely.
No other issues,
No
right?
other issues. Thank you so much. I'm really delighted.
Thank you so much.